$1.5 million Americans have filed for unemployment. And I'm going to quote now from TPN. It says actually 1.48 million Americans seek jobless aid, a 12th straight weekly drop, even as the virus threat intensifies. Continuing claims, which lags initial jobless claims data by 1 week, totaled 19.52 million in the week ending June 13th, down from 20.29 million in the week ending June 6th. Consensus expectations were for 20 million continuing claims. So, I mean, look, the bottom line here is that we are still in the midst of a deep job crisis. And this also happens at the same time that yesterday, this is in the Washington Post, new corona cases in the U.S. soar to the highest level in a single day total. Across the United States, 38,115 new infections were reported, 38,115 infections reported by health departments on Wednesday, surpassing the single day record. Texas, Florida, and California led the way, with all three states reporting more than 5,000 cases apiece. 3 states, California, Florida, and Oklahoma, reported record highs in a new single-day coronavirus cases, while hospitalization hit a peak in Arizona, where intensive care units have quickly filled. I was mentioning yesterday this piece in the Financial Times that South Korea, which is basically the global gold standard. I mean, there's success in different places. There's been success in, say, Kerala, success in Vietnam, different relative success in Europe, and then, of course, the United States, Brazil, absolute catastrophes. The UK, mostly a catastrophe. But South Korea, both in terms of the comprehensiveness of their healthcare system, the capacity to do tracing, and also, frankly, the infrastructure of democracy and openness around it. China's been very successful in some ways, but we obviously have not had an open process from them. They are having serious problems reopening. They are in bad shape. They're getting new infections. Now, if we've seen, Texas and other states with no real public health infrastructure, they're, now just finally belatedly asking people to put on masks. So we don't have an infrastructure in the context here. And we're already off to reopening at a time when we're just completely unprepared. And obviously I think the political calculus from the Republicans and many Democrats, look, it's very clear. It's like, number one, we don't want, and this started several weeks ago with, we don't want to pay out unemployment insurance. Nobody wants to do a comprehensive social safety net. If we had a comprehensive social safety net and froze rent, people could just stay home and be fine. And that would be the obvious, humane, and scientific thing to do. Then I think, we have to be really blunt. I have no doubt the Republicans looked at the numbers and were like, Black people, poor people, who cares? In addition, those aren't our voters. In addition to the fact that we want to discipline the labor market. So, I hate to put out pessimism about it, but I just don't see, there is not a context for this to recede. I am sure that Donald Trump's fever dream is that there is an October surprise of a vaccine. And I doubt it.
And good luck.
I'm sure he'll say that they have a vaccine. By the way, I don't doubt that at all. Whether or not it's the actual vaccine, whether or not it actually works, whether or not it can be deployed.
People will trust it.
Whether or not people would.
That fast.
I mean, would you trust a single medical piece of advice that Donald Trump has said?
No.
I mean, of course not, right? You have to be insane to.
I wouldn't trust a vaccine produced by his administration.
Of course not. I mean, honestly, I mean, yeah. I mean, how could you?